Now, I'm going to go down here and check her feet. I want to be certain that this water is staying warm. Now, why do I have her feet in warm water? Well, it helps to warm the body, but one of the other major things that it does is the feet are a reflex point for your abdominal area, your chest, and your head. So this, because she's got infection going on here in her head, her sinus areas, I want to be able, and she's got a headache, I want to be able to draw this blood away from the brain, and the feet are the reflex, which I can just throw a real quick one in here. You can always, if you have a bad headache, you can just get a bucket of water, sit in the bathtub on a chair, put it underneath the faucet, and allow hot water to go in, and you can sit there for 15 or 20 minutes, and 9 times out of 10 the headache goes. Why? Because it has dilated the blood vessels in the feet, and you put ice to the head, and what does it do? It constricts. So it's doing what? Pulling the congested blood from the head to the feet. Isn't that great? I just think it's so wonderful. So now I've tested, and it's cooling down a little bit. So now I'm going to take this hot water that I have ready for her, and you're going to take your hand and you're going to move her feet to the side. And then I'm going to start pouring on the edge. But as I start pouring, I agitate the water with my hand like this, because you don't want to scald your patient. You want to be sure that this water is going in very nicely and it's warming up and not hurting her at all. And so when I get that done, I just move it around. I just move her feet back over. Put the top on. Cover her back up. About that time, the bell's rung, and I can go ahead, and we can go ahead and use the cloth, wring it out real good, put it in my hand this way, and tell her the cold is coming. And here it comes. Now, I might want to check at this point. This heat has been on her face, and the water is drawing the infection away. Sometimes. There we go. Put it on that. Figure out how it will hold on your patient's head. Like that. That'll work good. So now it's on there for just about 30 seconds. You know, if it runs a few seconds here or there, it doesn't matter. And I'm going to just grab this and just do a little bit more friction over there till it's, and it feels good by now, doesn't it, Helena? Oh, sure. Feels really great. So now I'm just going to tell her the heat's coming. Now, the other big thing to do is you can get a dry washcloth, and when you take this wet towel off of her body, you want to just dry. You want to make sure there are no droplets of water left on her, because when the heat gets put back on her body, the little bit of droplets of water that could be there that are cold can cause a burn. It'll make a steam and cause a burn. So you always want to dry this part of her body off, and then bring back down the towels, cover her up good. And now we'll just have another fomentation. We're going to put it back on. Now, mind you, we're going over here to the microwave. Whoops, taking out another fomentation. I guess I've used most of mine. In a plastic bag that you've heated up, and depending how big your microwave is, you can put 3 in at a time. And what I do at home is I put the microwave, after I've taken out one fomentation to put on, I put the microwave on the 3 minutes, and so, or 4 minutes, I actually do it 4, so that by the time I run back in and put it on the person, almost it's down to 3 minutes. And so the 3 minutes are on. When I hear the microwave ding, I know it's time to go get the next one. So there's all kinds of simple little things you can learn to do to make it easier and more efficient for you to do. But if not, you just carry a timer. And you'll see on one of the other DVDs, there's a kit to show you how to pack your whole kit, have it all ready, stuck in a closet somewhere. Someone gets sick, you don't have to run around the house to figure out where things are. You can just pull your kit out, have all your fomentations in there, everything that you need, and you can give whoever is sick in your home, or someone calls you, you can just put it in the car and take off, and then you have everything there. And that makes it really convenient. So now we've taken out another fomentation. It's wrapped in this blanket. Put it on her. Now, The next thing I want to show you, she could be saying to me, oh, Valerie, my hip's burning a little bit. So I'll say, okay, Helena, let me get over here a minute. And I turn her over. And what you do is you have extra washcloths. And you put one right where it's burning. Lay her back down, because that will happen most of the time because of the fact it's trapped between her and the bed. And then she might say, well, you know, now I feel it on my shoulder. So then I just pull her back up. I put another little washcloth right there. And then she may say, oh, it's getting really hot here. So you take your hands like this. I'm going to go underneath this fomentation on her skin, and I'm going to go like this. And just smooth across her skin, lift it up for just a second, and then when you put it back down, most of the time it's very comfortable. So it would be just like this. I'm putting under her, and I'm lifting it up, and then I'm going across her skin just like this. So remember, it's lifted up for a second and then smooth her skin. Usually that does the trick, and it stops any kind of heat or burning. So those are ways. So for you to be able to handle any little thing that goes on, and even if she says, well, it's burning me right here, Valerie, so then I may take my hand and just do a little bit of this, but if not, I'll just do this, because where the bony areas are is where your thinner your skin is, and that's the place that is more apt to feel the burning. And so that you just keep patting all the little pads. You don't have to stop the treatment. You just put your little pads wherever it needs to be. So is my patient nice and comfortable?
Very comfortable.
Now remember, once again, I just want to reiterate this. The heat's on. Now what's it doing? Dilating the blood vessels, pulling the inner congestion in her lungs. She's got a very serious case of flu. It's affected her bronchial tubes. So now we're pulling the congestion in that area, the diseased blood, we're pulling it to the surface. At the same time, it's pulling in good, healthy blood that's full of white blood cells, lots of oxygen, lots of nutrition in this fresh blood that's coming in. And now we're going to take, again, the cold is coming, Helena, and we're going to cover her up like this. Now, what did it just do? It constricted the blood vessels. And what's it doing when it constricts? It's carrying all that waste matter, Helena, that we just pulled up, and it's carrying it back through all the cleansing organs, which are your liver, your kidneys, and your lungs. Now, I know you're saying, well, her lungs are sick, but that's what it's doing. Her lungs are supposed to be cleansing, but they're sick right now. They have disease in them. But because we have done this treatment, it starts to open up her lungs, and her lungs are able to start doing some cleansing and kick out whatever problem or disease that she has that's going on in there. So you can just see how this is going to work. We're pumping the blood up, and we're taking it back through the eliminating organs. How could you not be healthy? I mean, it's going to get you well in a relatively short time. So now we're going to finish the treatment. I'm going to take a cold mitten here, squeeze this here, and I'm just going to rub it across her face real good. Take the sinus pack off. Still want to keep her warm. The big thing that you try to do is don't allow her to get chilled. So if you're in a room, shut all the doors. Try to keep it nice and warm, because you don't want her to get chilled at all. So now we're going to finish down here. And what we're going to do is take this off. We also have a pitcher of real cold water. But let me tell you, she's so nice and warm, it'll feel good to her. So we're going to reach down in, pick her feet up like this, and pour the cold water all over them. And it really feels good, even because she's nice and warm. You can get away with it after the first part of the treatment.